This is a report for a 21-year-old male who came in for a head, face, neck, eyes, ears, nose, and mouth assessment. First off, I started with palpating his head. His hair was blonde, clean, and evenly distributed. Upon palpation, he felt no pain or tenderness. His scalp was clean with no dryness, dandruff, and his hair was blonde. From then, I went to his face. His eyebrows, eyes, nose, mouth, and ears were all symmetrical. I palpated his temporal artery, which no thrills were felt, and pulse was palpable. From there, I palpated his frontal and maxillary sinuses, which he reported no pain upon palpation. From there, I went to his eyes and his external eye structures, such as his eyebrows, his eyes, his eyelashes, and they were all symmetrical. His pupils were equal, round, and react to light and accommodation. His conjunctiva was pink, his sclera was white, his irises were blue, and assessed from the side, his cornea was round. There was no drainage, and from there I went to the nose, which was midline. His septum was midline, and his nasal mucosa was pink. His nares were clear and patent. And from there I went to his ears, which were symmetrical and no drainage. And upon palpation, there was no pain or tenderness reported. From there I went to his mouth. His lips were pink, moist, and intact. There was no dryness or sores or irritation. His tonsils were intact and not enlarged or inflamed. His teeth were all there and evenly distributed. His buccal mucosa, hard and soft palate, and tongue were all pink, moist, and intact. His tongue was midline. From there, I went to his neck. His trachea was midline, and upon palpation, he reported no pain or tenderness. There was no lumps, bumps, or bruises. And then I assessed all lymph nodes, which were non-palpable, but they were all intact. From there, I assessed his thyroid, which was not enlarged or inflamed, and all cranial nerves, 1 through 12, are intact. Thank you.